left like
Oh,
Monday, it was a little too much time, honestly. Well, and like, I came into work on Monday, like, you know, like, we should have, exactly.
So.
But it was cheaper to fly on.
I work with Kingston.
Oh.
We went to,
Yeah, we flew, well, connection in Iceland. Yeah.
Just
No, we
try.
didn't say in Iceland.
Oh, interesting, okay.
But
My daughter
then,
is, she works for Hopkins.
Ireland.
So, yeah,
Bunch of cars.
Working very with
Then,
it.
Very,
But she, I know that they
And girls,
she's does,
and then overnight train
Yeah.
to London.
public health.
Oh, that's really
cool. So she's really some.
That's a nice trip.
And Zoe's just got 13, so it was a good age, and she was
For
a
some,
child.
Yeah.
I mean,
Yeah,
hers
yeah.
was on
And some of the
the stores, and she's found some.
Yeah, they have a lot
progress
of partnerships.
on the
Actually,
That's what- If I read their stories, yeah.
I'm gonna see this being wrong with that, about that.
I haven't remembered.
Yeah, I got a lot of work. There's a lot of people that go through years of careers, studying the
Yeah.
using age.
Yeah, I know, because I want to take Foggy now, I was like, I don't think I'll learn
Oh,
how to
yeah.
anything.
Oh, yeah.
Yeah.
I could ask her about that, but I'm not sure. That's interesting.
Yeah, she might
I-
know. There's
I was looking at the calendar, I was like,
There's a
oh, so
person
that's
who
next
retires.
year, which my dad is going
I
to,
do,
we have 5 days built
They
in.
take it around. It's very, it's been around for a long time.
It's a 17-hour
It's a
flight.
17-hour program.
Oh,
Okay,
okay.
ready for this?
Yeah.
I don't know if she's doing it.
Would get you ready for this?
Yeah, it's interesting. Yeah.
You have debating, I'm like, is layovers better, or is it better just to do it?
Layovers are not bad.
No, that, I agree.
16-hour flight versus
Oh, no, you know what?
Where are you trying?
South Africa.
And you're trying to set up between going direct long flight and then, or 2 flights with layover.
I can tell you something.
Or direct.
8 years ago, with a toddler?
4-year-old.
Yeah.
Oh.
That's different.
Do you know,
Yeah.
do you know, I have friends who live locally and they have a 2 and a 3-year-old, they took to India recently.
Yeah.
And she's terrible.
So we're already streaming. Welcome
You're
everybody.
doing it.
I don't know yet, it's just an idea, I was just looking at the Kingston City School District schedule. It's like, I was like, are we gonna get 6 snow days? I don't think so. I'm betting against the system, betting in favor of climate change.
All right, y'all, there's some printed agendas there, if you'd like it, I've also got it up on the screen, thank you. I'm not gonna say it's gonna be a quick meeting, because it's never so, but, we've got a sort of a bunch of little things to go over today. Bunch of smaller things, usually we have one big presentation, we're gonna talk about Heal Ball today, but we don't have a full presentation, but just sort of an update on it. But then we have a bunch of other things to talk about. Going quick quickly into the admin stuff, I'm gonna ask you all to consider approving May and June. I've got a printout of those months' notes, if anyone would like to review that to refresh your memory before we vote.
Remember anything?
Yeah, so why don't I move ahead in the agenda then? And we'll come back to us, so give you a moment to pass that around. And then actually, but why don't I kick us off with a round of introductions? So let me stop sharing the screen, and we haven't seen each other for a while, it's just good practice. So I'll kick us off. Feel free to say your name, how you identify, if you're part of an organization. That's about it. All right, so I'm Emily Flynn. I'm the Director of Health and Wellness for the City of Kingston. I'll go around this way and we'll go to Sarah last. So Kristen, I will, she, her pronouns.
Kristen, she, her, Department of Health and Wellness.
Susanna, she, her, Institute for Family Health.
Kyle Beether, and I'm an independent consultant. I work with the Gates Foundation.
Katrina Light, Hudson Valley Farm Hub, she, her.
Heidi Kirchner, YMCA, Kingston, Ulster County, she, her.
Hello, Sarah Brand, Kingston Land Trust.
Right. Thank you, everyone. Very efficient. Well, I'll go through a few administrative minutes and I'll come back to the meeting minutes. In case you weren't on her email list, Marcia has left her position with us. We missed her already. She has not shared with me what she's going to do next. She sort of mentioned that she's did a few interviews. She mentioned they were outside of the county, so that makes me feel a little better. Maybe that he wasn't just going to a different org right next door, but I would be welcome even for that. She's such a gift. Yeah.
Are you looking to refill the position?
We're thinking of changing, this might lead a little bit to some future conversations we have today. I'm thinking of changing the position. So Kristen and Marcia's positions were project managers, and they're pretty high level. The job descriptions were written in a way where they would each sort of oversee their own programs at a pretty high level. And I think I've sort of identified that I might want a little more of an administrative role. And as we sort of are looking a little bit more towards the future, maybe the person might have a little bit of research or some data collection kind of background. So not to jump ahead, but looking at the collective impact role, they really suggest sort of 3 core roles in a collective impact structure, which I can get into more about what that all means. All to say is, sort of feels like there's a best practice where there's a little bit of an executive director position, a project manager position, and then sort of a data position. We're very small. I don't know if we have a full position for each one of those roles, but having someone that can help Kristen and I with a little bit of the admin work can help us, I think, spend more time strategically thinking, do more of the project management things, and then someone, even if they are not a statistician or a data scientist, but someone that I can say, here's my biped data, enter it for me. Or go on to the AARP website, research how they collect their data, and let's follow their best practices. So we don't have to make it up. There's a lot of guidance out there, but someone who doesn't mind sort of filling that more directed role. Did I answer the questions about that? Sound cool? All right. So, but yeah, changing our department. I'll leave it there for now. We can come back to that again if we need to. Wanted to mention, I haven't sent this to Heidi yet. We got a request for a letter of support. Our usual procedure is if anyone can send myself or Heidi a request for a letter of support. If Heidi and I agree that it fits in the values and goals of Live Well, then we sign it and send it back. This one specifically is for a sidewalk improvement plan, which I've been deeply involved in with Complete Streets Advisory Council. The city was already going to apply for funds for a sidewalk improvement plan. We realized that the New York State Department, DEC, Department of environmental conservation. The grant that we were gonna apply for, we didn't qualify because we had reused it previously for the pedestrian and bicycle master plan.
Okay.
But good news is the grants department has identified a second potential grant funding source. So we're writing the application a second time. Sometimes when you go through that, the good news is you've already written a grant application. You have all the information, it's all ready to go for the next source, right?
Plug and play.
Yeah, so all that to say, this would be in support of a sidewalk improvement plan, a little bit adjacent to the bike path master plan. The part that I think is the most important with the sidewalk improvement plan is the way that we fund the improvements. This plan would break down the different options for how we might fund sidewalk improvement.
Okay.
I can go into that more if you want. So currently, homeowners are responsible
Right.
for their own sidewalk. Each person doing it themselves is a big burden. Currently, a lot of sidewalks get improved when the city applies for a grant, so little sections will get improved. But there's no plan for a sort of a citywide improvement. Different municipalities handle this in a different way. Also, I should say, for the most part, I'm just gonna share Anthony's on Zoom, I'm sorry, here's somebody. Any city resident right now could be asked to improve their sidewalk currently. It often doesn't happen, it does sometimes, but it's not actively happening. Another option is sort of what Ithaca has done. They have created a sidewalk improvement district. It's a bit like a library tax. Everyone pays in, either the city, there's a prioritization of all of the sidewalks, this plan would include all that prioritization. The city would sort of go down the list and start improving sidewalks. It would all be done uniformly, it would all be done to ADA standards. I think that's a real benefit. If the city, that would have to go through a referendum.
Right.
It's a whole deal. Some people may not choose to do that. If that got voted against, this plan would suggest that the city then enforce the code and ask people to start improving their sidewalks. So there's a lot there. There'll be a lot more to come if we, let me also say that if the city doesn't get the grant funds to do this sidewalk improvement plan, the mayor has allocated funds and it's in the budget for 2025 to do it no matter what. That's very interesting to me. So this project.
One time do it.
No, funds to create a plan.
Oh,
So then that would, so nothing, no construction would happen.
okay.
It's just the
It's just-
framework.
It's a thinking through how we might pay for sidewalks.
The
Yeah,
main goal is to figure out funding.
yes,
Funding
Yeah.
modality.
that's the hard part.
Right, probably a schedule on who would be, what the approach we prioritize.
Right, so so the complicated thing is this plan will have multiple structures from different municipalities of how it's done. The one structure, which is like the Ithaca template, it would include, if we decide to go forward with that, all of the details. So, because it's really hard to say yes to something if you don't know how it'll be applied. So in order to offer that, we have to say this percentage of revenue from when you sell a home, for example, would go into this pot. What's the percentage? So this would think that through and actually have a proposal for people to consider, not just the sort of ephemeral.
Right.
It's based on libraries, it's based on
Yeah.
value.
And obviously there would be a third party who comes in and does that work.
Because, so city employees can't advocate for it, similar to the community preservation plan. We'd have to find a partner that became an advocate and decided to push it forward. Yeah. So there's a lot there.
Mhm.
This is, right now, all I'm asking you all, or Heidi to agree with, is a letter of support to apply for funds for
Yeah,
this.
makes sense.
Who's requesting the letter?
The grants department.
Oh, okay.
It must be, I mean, I don't know, just anecdotally, this is something that when I talk to other families, other people in Kingston, it's like the number one thing that people talk about as problematic
Sidewalks.
sidewalks.
Especially people with strollers or.
Yeah, or if you have.
Disability, yeah.
Exactly,
Right.
like, so interesting, I wonder, is there has there been any discussion or any kind of data collection on public interest in this?
No, that is one of the first steps is a poll, is like a
Okay.
phone poll. They did that for the community preservation plan, so it's sort of a straw poll to see how people feel. I get that feedback a lot too. I ask, if you start to have conversations on the playground, ask people if they're willing to pay an extra tax for it. This isn't necessarily a tax, there's other language, but sometimes I ask that question, like, well, how much are you willing to spend on it? And then people's answers often change. I find that fascinating. To me, it's ultimately a decision of what's the value? How much do we want to spend on sidewalks? Or how do we spend it?
Yeah.
Do we each individually spend on it, or do we collectively
I
spend?
mean, I feel like if it goes to the individual homeowner, it's gonna be a little more tricky because of all the improvements in Kingston. Like, I can say personally, when they did the roundabout, they did all the sidewalks up to my house and they did all the sidewalks down to my house. And I'm like, ha, or me and my neighbor, the two that
Right.
didn't. And I'm like, if we then had to pay, but then my neighbor just was included in the plan, like, no, it's kind of like,
Yeah.
all right. Like,
Yeah.
whereas I mean, I think I've expressed this before, that I don't ever think about the library tax, it's just something that's part of our city, and I use the library, and I think it's great, and like, it's one of those things that anytime you have an additional tax, it's gonna be like, oh, I don't want an additional tax, then you get used to it, and everyone benefits from being able to walk on
Yeah.
sidewalks and like fall, and in the winter too, just think about having like infrastructure to actually clear the sidewalks.
Right, it makes it so much easier.
Because right now,
That's
you can't-
another part of the discussion, is the maintenance side.
Yeah, that,
And
You're
I
trying to
always
know
think it's-
anymore
I always think it's crazy that we rely on individual property owners to clear sidewalks.
that
It doesn't make
everyone
any
uses,
sense.
that everyone uses.
Exactly.
And yet, we treat streets differently.
Yeah, it doesn't
Yeah,
make any
Right,
sense.
and
Yeah,
my
it's a
neighbors
really
who are
outdated, I mean, it's-
80 years old.
They probably developed these policies, during like the age of the car, so it was, now we're finally realizing, man, we should be driving everywhere.
Right,
Or
and
maybe,
if you want
maybe
to
it's more
encourage
supporting small businesses.
more walking and
Yeah.
more everything, you gotta make it comfortable for people to move around
And you definitely
safely.
see in the snow how many people walk.
Right.
It's
Yes.
like, oh my God, there's already people out here, it's only 8 o'clock. I'm like,
Yeah,
It's great.
So a lot more discussions to happen. I hope maybe this commission will stay involved as that plan goes forward. So, yeah, a lot more. Hey, I see that Anthony has joined us. Hey, Anthony, do you wanna, say
holy
hello?
cow, he's got a tie on. Whew.
Hey guys,
Hi.
Anthony Fitzpatrick. Commission, what's up? I'm late.
No problem, great to see you. Okay, so we just went through, that was administrative matters, so I'm gonna jump back now. We definitely have a quorum, it's lovely to see everybody.
Yeah,
I'm gonna jump back to approval of minutes. If you all feel ready, I could hear a motion to approve, actually, I can approve both of them unless someone has edits for either of them. So I could hear a motion to approve the May and June meeting minutes as written, or I could hear a motion for edits.
I'm gonna make a motion to approve as presented.
Second,
Oh, Anthony got it.
Mhm.
Okay, so all in favor to approve Livermore Kingston's May and June meeting minutes? I see hands in the
Aye.
room, thank you.
Aye.
I see hands on the screen. Thank you, everyone. The motion passes. So easy. Okay. That brings us to new business, good food purchasing program. Kristen, ready to go?
Yeah, that was an interesting letter, by the way.
Yeah, it was.
I've never heard something like that, yeah.
Great.
Yeah.
Wonderful. Yes, I'd like to share this with the commission. This was discussed in the Eat Well Focus team. So just, I don't know how much people know, but to back up a little bit, the city of Kingston has updated their healthy vending guidelines. And through updating those, we included what we're calling food production standards, which are based upon this values-based procurement. I brought this up a lot and Eat Well because this is it's a national trend going on from the good purchasing program as well as a statewide trend that is going on because of this letter that I shared with everybody.
Sorry, what's the good food purchasing program?
So
Is
the
that the
good-
national?
So there's the Center for Good Food Purchasing, and then they have their Good Food Purchasing program that I feel like There were some organizations that were doing similar things around value-based procurement. Right now, they feel kind of like the largest entity that's doing it. The way they work is that they work with institutions that do large amounts of purchasing and help to establish like baseline metrics, help to establish the infrastructure of the program and do measurement for it. There's a fee that comes with that. So, if an institution is interested in that, usually they build into their budget, they could get a grant or something. So they have these 6 values with which the Good Food New York bill, the language was sort of based upon that. Community Food Advocates is an organization that's based out of the city that does a couple of different things, but one thing they do is they run the Good Food Purchasing campaign for the state of New York. So they do it both in New York City and they do it for the state of New York. So they worked on that, just, to share, Senator Hinchey was the original sponsor of the bill, so it's something that has been around for a while. And they approached Lidwell to see if the city of Kingston would be interested in signing on to this letter. I said that that's not something for me to decide. I do not touch any specific legislation and lobbying, but I am more than happy to share it with our eWell focus team to see if it was something they were interested in. And we do have that in the action plan for eWell to support policy change to increase access to nutritious foods. So they agreed that yes, they wanted to recommend this to the commission to present to the mayor to sign on for the city of Kingston. And so the way that would look is that, we've done this in the past. The mayor would sign it as like the city, Mayor Noble is signing in support of this. He could also write his own letter. He doesn't have to sign on to this letter that I shared with everybody. This is just the one that that Community Food Advocates put together. There is a bit of a tight turnaround for this. We wanted to follow, since we don't get many of these very often, we wanted to follow kind of the processes that we have set in place. And they are asking for people to sign on by September 20th. And I told them, I feel like that might be
Tomorrow.
that's on Friday. I think that September 20th actually came a little bit from the fact that I told them the commission meeting was on the 18th. And I was like, I probably couldn't get it to you before the 20th. And I feel like that was like, what's at their deadline. So that's what it is. Sharing with you. If you have any questions about value-based procurement, or I can just share, my knowledge on the content of the Good Food New York bill overall. I want to be clear, while we are live streaming, I am not telling you which way to vote on this, but I'm more than happy to answer questions about it, just because I feel like I've talked about it so much at this point.
So you need a letter from the commission supporting this as well, or are you just gonna take your letter, put it on a letterhead and sign it?
So the mayor would sign it.
But our letter to recommend to the mayor that
Yeah,
he
I
should
guess,
support
I don't
this.
know, we didn't really talk too much, I there's like the scientific base now, about the exact process of what we should do to make the recommendation to the mayor.
Because it shouldn't come from you.
Well, we can report on what you decide tonight.
Oh, okay.
So I don't know that you need to put it on
Like
letterhead.
formalize it, just say
Yeah,
that
but I guess I would recommend maybe a vote, a consent, so that we all
Right.
sort of document how
and
you
as long as
feel.
it's in the minutes, that they can go back and refer that, yes.
And it's recorded,
yeah,
that's
okay.
that's mostly our minutes, so then we can report to the mayor, by the way, the commission is encouraging you to sign this, that's what can be done.
What is the bill actually do?
So right now, New York State has some of the strictest procurement laws. So this would be an amendment to General Municipal Law 103, and that dictates procurement that is required to go through a bid process, and that's about $20,000. So for the city of Kingston, we don't do food procurement in that sort of quantity. It is specific to food, so I don't actually know General Municipal Law 103, but I know that it like dictates about like.
Well, that you know that bill is impressive.
I know that it is the one that they are recommending be amended with this bill. And so what right now, like for instance, the school district receives state funds in order to be able to purchase food. They purchase much more than $20,000 in food, so they have to go through this bidding process. They are required to go with the lowest responsible bidder. So there are sometimes elements that can be included as specifications in the bill. The school one, I'm not even gonna step into all of that because there's so much there. It's like an example of an institution I feel like most people know about. But ultimately, the part is that they have to go with the lowest responsible bidder, regardless of some of these other things. The Good Food New York bill will allow institutions to go with a bidder that is up to 10% above the lowest responsible bidder if they meet at least one of the values. And the values are nutrition, local economies, environmental sustainability, valued workforce, and animal welfare. Racial equity, there are 6. You know, I would love to have an offline conversation on my thoughts on the Good Food New York bill, but that is what it would, it doesn't mandate or require anything, it just creates an allowance that they can go above the lowest responsible bidder.
Is it kind of similar to the values-based procurement guidelines that you would have worked on within the city? Is it kind of a similar framework?
Yeah, so the values, the food production standards that are based upon the value-based procurement guidelines, I used mostly language actually from the Good Food New York bill to include in there, just figuring even though our RFP process for the vending machines wasn't a part of like general municipal law 103, that it seemed like a good place to pull language from. So yeah.
I think it's really important to like take a look at value is more than just the monetary cost. I think this is
And 10% higher is not that great.
So
I mean
I asked, that was my question, I said, this was like a couple of years ago, I was like, oh, did you do a cost analysis to know how much it was? They shared that 10% is, they were advised to do 10% in the bill for this one because that is the precedent set by the MWE program. And so that is why
It's
it's
a goal for women.
minority 10%, it's you can, for certain procurement processes, I'm not totally sure, you can go 10% above the lowest responsible bidder if the bidder is a certified MWE. So, I would say probably it's a start to something, but yes, that's why it is 10%, and you are correct in thinking about the cost of food. But
What is responsible? How is that? Do we know?
so there's like a website, I feel like when we get.
That has anything to do with like values, that's just
so I'm pretty sure that like
financial.
if you like do something to be recognized as not responsible, you're just like not responsible anymore, and you're just not gonna be going places. I think it's kind of how that works.
There's like a website that you can go onto, and anyone that has to maybe it's an audit, it's like.
Yeah, it's very basic, yeah.
Food service provider LLC, like business standards.
Yeah.
Everything else.
Yeah.
So yeah, this is very similar. This is my world I worked in for a long time, with the Real Food Challenge.
Yeah,
It's very similar in language. A lot of schools, it was like a student movement that came about like 10 years ago and pushed colleges and hospitals and universities and kind of institutions to do this. They didn't do the 10% cap. I think with BARD, we started like our local sustainable food at like, I think it was at like 3 or 4%, getting milk and apples. And a lot of schools, that's kind of where people start. It's like, we're an apple state, that's an easy one, local apples, dairy, and then this kind of helps start to look at some of those other categories. And so we moved it with a 15% increase in our food costs from, like, I think it was like, 4 to 7%, I can't remember what the starting point was, up to 27% within that. Sustainable, animal welfare, there was like different categories, it's like, even if you're hitting a little bit better, it still kind of pushes the needle, so I think this is exciting.
Yeah, I do too.
Yeah, me too, makes a lot of sense.
Yeah.
We have to vote on this?
Any other questions? If not, I'm gonna invite someone to make a motion. How do you want to word it, Kristen? What are they're voting to do, to sign on to what?
No, you're voting, to make a recommendation to the mayor to sign on to
Yeah.
the letter.
Great.
Okay, so I will make that motion to make this recommendation to the mayor to sign on to the letter.
And second, to support this legislation.
Yeah.
I second it.
Oh, but Katrina beat you to it.
Oh. I served.
All in favor?
Hi.
Great.
Motion
Exciting.
passes.
Great.
Great, so, we'll send the recommendation in there.
Sure. That's wonderful.
All right, y'all, that brings us to an Heal Well update. Now, Kristen and I talked over a month ago, so we will probably be a little rusty in our presentation to what we've sort of come up with, but let's fumble our way through it together.
I found my email.
Oh, yeah.
I know, I was like, I'm not under the greatest details. I found what I emailed. You know, we have a member representing from Heal Well actually in here. So Heal Well is our focus team that, you know, I think was, I have to go back and look actually at exactly the mission and vision of it. A lot of representation from our healthcare providers, our healthcare community in that group. And we've been meeting like pretty regularly, but I think still having some challenges in determining exactly the purpose of Heal Well in the space of the larger like ecosystem of similar groups. You know, we've got Integrated Ulster that's doing super good work. There's Healthy Ulster Council. So there are a lot of other places that are focusing on either access to healthcare or support for mental health or connecting healthcare resources, connecting providers with social services, all of those things that might kind of fall within what we were working through the scope of Heal Well. But yeah, so they were already doing them. So it's like, what is our purpose here in Heal Well to contribute rather than just having meetings to continue hosting meetings? As much as I feel like I wanted to keep hosting meetings because I liked the people that were in the meetings. Oh, we had we have Anthony too, who's part of Heal Well. But ultimately decided that, you know, we all attend a lot of meetings. And so
And we discussed with Teresa, who was the chair of Heal Well.
yeah, we discussed this with Teresa, who, you know, Teresa is so lovely, so I'm like, the sun is like following me. Discussed it with Teresa, and I think, you know, also part of this, like reflecting on, I mean, this is like also a little preview for later on, just like the purpose of our department and the purpose of Live Well, and that we don't really have the capacity to host a lot of programming or activities. You know, there's only a few of us in the department. So it's not really something that we can add to the landscape of things. And it didn't really make sense also maybe as like city employees to be doing that when nonprofits are already doing it. So yeah, discussed it with Teresa, emailed everyone in Heal Well already, and, you know, asked for people to come forward and share thoughts. I think we thought I was the only one who emailed her back after all of it. And deciding to put what is, you know, like indefinite pause on Heal Well. So kind of the idea of the focus team going dormant, but can be activated for special issues. So if there's something that arises that we're like, oh, this feels like very timely and we should be a part of it, you know, we still have, I have a list of all of the emails of people who have ever been a part of Heal Well, who have been like active like throughout it, so we can always activate it when those issues arise. And then I think our third bullet point, we talked about, sorry, I'm like, I'm blinded, you're like, is consider hosting an annual gathering to check in. So if we didn't really want to lose that connection completely, we could always think about something like that.
I will just add that I think part of the impetus for this discussion too came from a declining attendance, very inconsistent attendance.
Yeah.
And in fact, it got to the point after so many years of actually not being that much representation from the healthcare community.
Right.
So,
Yeah.
yeah.
To reach out to them.
yeah, so, and I think it kind of very much intertwined with not having a clear focus as a focus team. And I think people don't show up when it's not clear what they're gonna do, like what the purpose is. So,
Yeah.
people start thinking, well, I'm not really sure what I'm getting out of this. So, yeah, and I think that's, I mean, I was feeling that way too. So, I think it's,
I think we tried. We had like multiple meetings where we're like,
there's a lot,
okay,
as you say, there's a lot
brainstorm.
going on.
I know,
In
yeah.
Kingston, well, or in the county that impacts Kingston.
Yeah.
So,
And to get to Kristen's point, again, we still have all those contacts and resources. So if our role is to echo what other great agencies work that they're doing, we still can do that. And so I think the bottom line is here, we wanted to let you all sort of know that we were thinking of letting HEAL go on an indefinite pause. And then this will lead into our next agenda item as well, which is sort of some strategic reflection. But of course, we wanted to bring it to you all, and if, there's strong feelings about it or feedback, that's part of this discussion. So it's definitely, I think hibernation is a right word for it. We still have all the resources and we can reactivate it if we need to.
Do you think it would be a more sensible thing to do that instead of like putting it on an indefinite pause to just put it aside for a set amount of time, 6 months, a year, whatever,
So
to come back and like talk about it again?
yeah, I mean, we did pause for the summer, so I think we like very specifically took 3 months off to say like, oh, like let's like take a rest, maybe see who's like knocking on our doors to start Heal Well again. So I don't know, I kind of feel like we did that, but you tell me.
Well, I mean, like, we could just put it away, but we could also like put it away and see if you want to take it out next year. If things haven't changed at all and we still live, gonna put it away for another,
It's a good idea, maybe like set a date to come back
To
to
revisit,
To
see if
revisit.
there's a need.
see if there's a need,
yeah, just rather than in.
It's a good idea.
If every 12 months or maybe 18 months or
Yeah.
something like that.
Yeah, I think that was a little bit of the thought of like an annual gathering to like bring people back together again, to like have that thought of like,
Yeah.
hey, let's see each other again. Do we feel like there's a need? Yeah.
Are the goals of the, I don't remember the goals of the HEAL Well group, but I mean, it's around, I believe that, like addressing diabetes is part of it, one aspect, that
No,
chronic
that
care
was-
management.
That was part of the issue.
But I'm wondering is, because oftentimes these type of efforts that are focused on social determinants of health are trying to have an impact on, preventing diabetes or.
Yeah, it wasn't, it started off that way a decade ago, when Lidwell first started, but it morphed into, I think, more of a all-encompassing kind of idea of health, right?
Yeah.
Well, that's for live, but and Heal Well.
But Heal Well too.
Also, part of the issue is we weren't sure if we were focusing on the health industry
Yeah,
staff
right,
or the community. So
Yeah.
that was a big,
right. So there were people who were members who were part of, not the healthcare industry, so other modalities that wanted to have a say in what it meant to be, for healing. So it's like, how do you combine those and come up with, I think that was part of the, sort of the, anyway, wasn't very clear.
does anyone want to hear the Heal Well mission statement? You ready for it?
Sure.
Go for it. It's a book. Heal Well mission, the Heal Well mission, to promote complete physical, mental, and social well-being in the city of Kingston by directing and supporting changes in policy, systems, and environments, providing tools to patients and to healthcare and human service providers to treat and prevent lifestyle-related chronic diseases, and creating health equity or social justice in health, so everyone in Kingston has a fair opportunity to live a long, healthy life. Now, I don't disagree with those.
Yeah, but it does overlap a lot of the other commissions.
Yeah, exactly.
So I mean, every sentence you said, I was like, well, that goes into,
Yes.
so move well, oh, that
Yes.
goes into, eat well,
It's
oh,
like
that, so.
Foundations.
Age
Yeah,
well,
something like with our billions of dollars, we're going to.
Yeah. Yeah, and I found, I feel like in our meetings, there were a lot of people interested in mental health, but like the county does mental health, so it doesn't really make sense for Kingston to do it. And then I feel like a lot of the projects, the ideas ended up being like, was that eat well? Because that's like food, right?
Yeah.
Right, a lot of people were really interested in food.
Like our walk and talk with a doc, which was very successful with Institute for Family Health,
You're good.
the focus was on food.
Yeah.
So just take that out in the existing.
And
focus.
even like the chronic, disease aspect.
Oh, no, I was waiting. I just wanted to make sure I was known. My little raised hand didn't work before. I work in healthcare, in the finance revenue cycle side every day. And as part of my presidency of the Healthcare Finance Management Association, we're constantly being asked by providers to talk about what's happening in communities. There's a fine line between a provider as an entity, a nonprofit or for-profit hospital, and the community they serve. And they're trying to narrow that gap. So I think there's quite an opportunity to touch on the things that aren't in the other subgroups, right? Like what legislation and policies are coming up that are going to affect our patients in the community, all those types of things. So I think there's so many groups that are doing all that work right now. There's folks that enroll folks in Medicaid that will go out to the streets. There's folks that are the mental health organizations. There's lots of, I think what we could be, instead of a group that meets regularly, is just a group that provides resources, a group that says, here's what's happening, here's something new, don't forget to go see this. Maybe pull, even if they're not on this commission, there's resources and folks that should be aware that we're here as kind of a launching pad to say, here's all the things that are happening, a connection point, because there's legislation that's coming through. Price transparency, huge. Patients need to understand what all that's about. And I think that just makes you have better health and care and the ability to pay for that. So that leans in that social equity piece of it. There's constant work on social determinants of health. There's all these pieces, as we mentioned, touch all the other groups. But I think there's still a big gap in knowledge out there. If you don't know how to read your bill, then, there's just some tools and resources that community folks aren't really aware of. And I don't see any other groups talking about. So I think if we're a connector point, that's maybe could be our purpose until we are ready to regroup again.
Yeah, it's a good point, Sharon. Right. I would offer that it might be really nice if there are people who could join Heal Well to offer that kind of support. Thanks, Sarah. I think one thing I'm thinking for two things is, one, when I emailed people to say that we were going to put a pause on Heal Well, no one fought for Heal Well. Like, I'm gonna put that out there. No one fought for Heal Well. And two, this is thinking about my capacity. Like, I am pretty firmly in the world of food and nutrition at this point, and also how they're creating Healthy Schools and Communities grant. So that feels like a lot of work for me to learn another field, which I'm more than happy to help hold that space for. But I do want to just share that, no one fought for Heal Well, and it is a lot of extra type of work. But if we've got folks who are super interested in it, I'm always happy to hold space for that and to facilitate and provide administrative support for that type of work. But
Sarah, where are you seeing like the Coalition 1155, that's coming down, and that's a lot has to do with equity and connecting people with services. I mean, and that's exactly what, we're trying to elevate and make awareness to that. Is that something, and is that something like that? This is something that Heal Well could work on, because it doesn't, like you said, it doesn't fall into any other thing, and folks will have access to those resources and probably don't even know it.
Yeah, I think
Know what it's about.
Yeah, so stuff like that is we could just maybe become a little database for now, and maybe send out a communication, to. Do we have a newsletter? Is my brain remembering that? So maybe within newsletter, talk about, hey, these are all the resources we put together. If you're experiencing X, Y, and Z, like an FAQ quarterly that says, here's new programs are coming out to assist. I know a lot of those programs are on the county level, the city level, the state level. Nonprofit grassroots organizations work on a lot of this. One of the big bills that is just recently passed that is some of it's going to efficacy on the 20th of October is the healthcare financial assistance charity care law, where hospitals have to increase the federal poverty level. So you can apply for a charity / financial assistance if you're not eligible for Medicaid. And it also provides, you don't, in some states, not New York, you are not responsible for your debt. Hospitals can't sell your debt to a collection agency that is going to chase you down in a bad way, and they have to help you enroll for coverage and assistance. These laws are going into effect soon. So if you're not aware that, hey, I go to the hospital, I can't get Medicaid, I'm getting all these bills. One, you're not supposed to be getting the bills in the future. And two, there's something to help you. There's programs out there that people don't even know, and then they pay tens of thousands of dollars for their care, and they don't need to necessarily. So yes, sorry, I got on my soapbox for a minute.
Was there ever any discussion about maybe heal well and age well becoming like, because I see the eat well component and I see how they could be these things, but if there's no real like fight behind this one sector, maybe there's a way to like reinvigorate another one.
It's kind of hard because it's not exclusive of the age well sector to, I mean, typically it's more prevalent as you age, but it's not necessarily, I don't know, within the aging.
So it just depends on how you
Right,
frame
yeah,
it, right?
yeah,
It's
yeah,
like you could be 19 and still be aging well with with literacy around
Right.
healthcare.
It's true.
So I feel like that's part of a broader conversation about Live Well's common agenda.
Yeah.
So, thank you, Sarah. I think that we can still go forward with trying to be sort of a communications arm for some Heal Well goals. What I'm hearing you say is you can maybe provide us some of that content quarterly, is what I heard you say. So let's keep talking about that. In the meantime, I'm gonna move us a little bit along because I think it feeds right into
Wait, can I just say
some
something?
strategic reflection.
I
Yeah.
mean, I have definitely things to contribute to, if it's going to that level of policy and issues that are impacting people healthcare wise. But one question I have is, we're talking about issues affecting people who are lower income and Medicaid. How much does the communication that's produced out of this group actually get to that population?
And is that our role? I'm
Yeah.
thinking we're more advocates.
Yeah.
And we push the support of policies. That's why I loved how you framed it with literacy, health literacy, and you know, what can we do to advocate more of those services to be available?
I mean, I think hospitals certainly can be doing a lot better. I mean, we all can be doing a lot better in healthcare, but hospitals need to be doing a lot better at communicating with the full range of patients that they serve.
Right.
But like community health centers, you know, the vast majority of our patients receive Medicaid or uninsured.
Right.
And it's like 65-70% of who we see. So, and we have care navigators, case managers, et cetera, who do this kind of stuff. But there needs to be more transparency in a lot of the hospital interactions around, you know, payment and all of that. Yeah. And for people who go to, as Sarah, you were saying, for profit, you know, in private practices, where they don't have people who work on social drivers of health, right?
Right.
They don't do that. And people who do advocacy. So again, I just don't know that this is the place to
Right.
the communication, you know, maybe some of it, maybe, you know.
Or pass it on to our partners.
Yeah, maybe, I mean, I think it depends what the topic is that would be appropriate for the newsletter, but I think we should just think about the audience.
It sounds like there's already other groups that, one of the reasons why you also said that we should sunset Heal Well is because there's already other groups that are doing this.
Yeah,
Or
yeah.
like integrated Ulster.
Based on what you read.
So it might be duplicative.
Well, I don't see integrated Ulster doing what I heard Sarah, what I thought Sarah was envisioning, right? Do you?
Yeah, they're not.
I see integrated Ulster to me feels like it's networking for social service agencies.
They're trying to help encourage organizations in Ulster County to become what they call complex capable. So to be able to manage, people are complex, right? They may come to us, health or human services, they have complex needs and try to provide more services internally and or refer kind of internally in the network, and to help organizations become more trauma-informed, better customer service. They have a lot of sort of
No wrong door sort of.
Yeah. That, which is different than what Sarah's talking. I mean, I think some of those things that I think are important.
Yeah, they are.
And if it can be written really simply, you know, really succinctly, it's good to put it out there.
I was gonna say, I feel like this probably ties to what you're trying to get to.
Sorry.
We do.
No, this is all really good.
Well, yeah, I feel like a bridge that like I have an environmental policy intern right now, and he's very interested in trying to communicate policy to people. So I said, well, let's try doing a food policy bite. We are not calling it Food Policy Digest because there's already a Kingston Food Digest going on. But so he is trying to find ways to communicate about policy, like as an education, like lens, not like an advocacy lens. So like about Farm Bill, about SNAP. So we do have like something that we're like, you know, testing out, trying out currently. But I know you mentioned earlier with the coordinator position, a lot of like data entry, but we also talked about
Yes.
someone to help with communications because it oftentimes feels like
Yes.
people are maybe looking to us to not necessarily do things, but to communicate about stuff, and we just don't have that capacity between the two of us to really like take it on in a super intentional way, but we might have support, and I feel like that leads into maybe these other things about Llewellyn.
Thank you for that, yeah, I did, that would be a large part of the position as well, because I have a background in communications, so I know, I think, Kristen, you have a background also, so we know what we're lacking in. We sort of just need to be like, okay, I need you to create the post content for take this article, reduce it down to a sentence, and then put it on the calendar.
Chat GPT do that.
Shorter.
Shorter, make this nicer and simpler.
Okay, I'm gonna then just do so we've been talking about this a little bit, so hopefully this isn't brand new, but I'll just take a step back to say, so we started to talk a little bit about doing some strategic reflection for Live Well Kingston. And what's bubbling up here is, I think, a lack of identifying what our common agenda is. And what I mean by that is, Kyle has introduced me to a universe of best practices, guidance documents. There's many tools out there. And one of the baseline ones is sort of like, what is the issue opportunity we're wanting to address? I think we all might have a slightly different answer. So to me, that means that we need clarity on that. It's a little bit going back to Live Well Kingston's foundation and rethinking. We can, I think, be more effective if we're a little bit more strategic. We have 6 focus teams, more or less, right now. It's very broad. Right now, we're only 2 staff. It feels very broad to me. I think we need to go back and reflect, are we about chronic diseases? Are we about diabetes? Or is there another way to define what it is that we're trying to fix here in the city of Kingston? And so we did meet in July. We talked a little bit about that, and I think we had a really fabulous discussion. I think we started asking a little bit about, well, where did Live Well come from? And I think I was fumbling my way through that a little bit. And so I've started to create some materials that I would like to send out to you all. So a listing of Live Well Kingston's achievements, a little bit of a timeline, some of those sort of things so you can see what has Live Well been successful with? What do we have? What are sort of a SWOT analysis? What's really great? What's sort of unique about us being at the city government level? And then I'd like to bring us all together for another conversation to try to answer those kind of questions about what is the opportunity we're trying to address, what is the shared vision we're hoping to achieve, what data or research informs us. So in this common agenda framework, there's a real emphasis on sort of shared data. So you can show impact, so we're all sort of measuring the same outcomes, maybe the same way. And we're all using sort of the same language in the different work that we do. So I would like to propose that I'll send out a doodle poll to bring us together to sort of start a special meeting about it. Because I think what those conversations will lead us to will sort of reset. We may in that meeting decide we need a committee that focuses on equity and how that relates to everything. We may decide we want Heal Well. So I think that this is part of a larger discussion where we need to take a little bit of a step back on Live Well and sort of refocus or redefine, draw those lines in a little bit darker. Did I miss anything, Kyle? You think that's important? Anyone else? There's probably questions about that. Anybody want to add to that?
Well, I think it's, as long as I've been on the commission, it's been something we've struggled with.
Yes.
You know, to get that clarity of, what are we all about, And the same with Healwell, I think that was a struggle. They kind of didn't dissolve, but they're on the shelf, they're in the parking lot, you know, so. I think it constantly warrants the conversation, because I think, you know, all of these commissions evolve themselves and play different, and as they evolve, our role is gonna change as well. So I think it warrants the conversation, especially, you're probably absolutely correct, everyone's gonna have a different opinion of what the role of Liquel is.
And or what does success mean? Like,
Right.
what says that we've been successful? I think we might all have a different answer.
Have, I'm just curious, I remember years ago looking at Live Well programs in different parts of the country.
Mhm.
I'm just wondering, I haven't looked in a long time.
It's like Live Well Greenville.
Greenville, North
They
Carolina.
have done a restructuring, they have 3 buckets of work: physical activity, nutrition, and equity. That's part of where we may decide to go.
Right.
They have a team of probably 8 to 9 people
People,
at
right,
this point.
and their staff, right, yeah. I mean, it would be nice to share if you
Yeah.
could, so examples of other, I mean, I'm worried about not reinventing the wheel or learning from other wheels, you know, but that would be, yeah.
So these other Live initiatives, do they emerge from the Rockwell Johnson Foundation and Culture of Health, which I think is part of it?
That's a good question.
Really good question, I
I
have
don't
no idea.
remember.
Really?
But
So my
Live Well was definitely based off of Live Well Greenville, because it used to have the same focus teams. They had a worship well, an
Yes,
eat well, a
Yeah.
play well.
Yeah.
Basically, I think
Yeah.
was a little bit of the template that was picked up.
I think that's kind of what we're saying is like, are these circles all the same?
Right.
Which groups have more attendance,
Yes.
why,
Yes.
you know,
And to combine some,
could we
yeah.
combine something, get more,
Yeah.
get more
Yes.
energy if there were 3 and there's 2 of you, and like
Yes.
what's capacity and what's our deliverables at the end of the year, saying,
And like,
okay, we're
where
gonna
do these other roles get their funding?
funding, but also,
Yeah.
what, you know, we're talking a lot about like sharing out, or what I've noticed a lot in Kingston is like, there's a lot of groups doing a lot of similar things, but
Yeah.
there's no
Yeah.
one connecting the dots.
Yes.
Yeah.
There's no one saying, here's the calendar of when all the pantries are open, or here's the, you know, the kind of like glue,
Yeah.
like, maybe that's what we do, maybe not, but
Yeah,
like.
or maybe we focus on communications, as we've sort of been touching on here a little bit.
And then people are like, oh, thank you for this resource, I'm gonna post it on my website, and
Yes.
you saved me 15 hours of work, and thank you so much.
Yeah, I think now also our department has the bicycle and pedestrian master plan, it has a creating healthy schools and communities grant, it will soon have food systems plans, so like we also have different things that the department has evolved to include, that, I don't know, could be integrated or like parallel to the.
No, that's a good idea to think about what other assets or programs does the department. I don't feel like I fully understand the relationship between Live Well and these other efforts. But maybe there might be duplication or opportunities for better integration.
So what does the process look like?
For the strategic, so my thought was to bring us together, to have some of these resources, you talked about, looking at some other groups, having better clarity, I think, on, you said department assets, but also sort of, if I'm about to bring in another person onto our team, I want them to be able to, them to have a resource that says, what is the role of the commission, what is the role of the focus team, what is the role of staff, because that's very, I have an idea, but Kristen would have a different answer, so it'd be good to, I think, have more clarity on that before I bring another person into this chaos.
But there was one meeting, right?
We did, we had a meeting, we had a slide deck we were working on, but we pretty quickly, my memories, we went back into trying to remember the history of it well. So I don't wanna lose anything from that conversation, I wanna build on it, and have some more resources this time. Hopefully, I would love it if you all get a chance to review it before we start to talk, but my vision, and I love suggestions, was maybe even in a different location and put some things up on the wall. So the current mission statement, what the mission statement was when it was Healthy Kingston for Kids, some of the accomplishments that we've had, a timeline, maybe some resources, the way that it's currently set up, and then we can sit down at a table with that information having been downloaded and say, well, where do we want to go from here?
Great snacks.
And
It's always food.
does that sound
do you have suggestions on a process?
Well, I'm gonna be gone as of December, after December, so my
You
time
say
is up.
that.
Gone?
No, my time is up here.
Oh, the commission.
Yeah. So I was gonna say that, no, not gone, not yet. But, the, what was I gonna say, oh, timeline for this, sounds like a process, right?
Yeah, I think it's gonna be a process.
Yeah.
So I'm off the commission as well, but I can still stay on certain projects and kind of walk, listen and be part of it.
Especially if there's food at those meetings. Because I should come to a special food meeting.
Well, I also wonder, I mean, I don't know, there's probably, maybe there's different phases too, where some of it is, some of the conversations internal to the commission.
Right.
Then there's, I would suggest probably also some engagement with other partners. So if you're not on the commission, I'm sure we'll probably,
Yeah.
yeah. But I also think maybe beyond that, like, who are the other people that want to involve in the conversation? I think
And the community, right?
Right,
So we
yeah.
need to-
community, yeah.
We also talk about what bring we've talked about this numerous times, but bringing people with lived experiences into these conversations. Also, this brings up a big conversation about assessment and surveying people or over surveying, what data we want to look at. So these are all parts of that reflection.
I mean, if there is gonna be a huge or larger transition at the end of the year, beginning of the year with folks coming off the committee or people coming on, this would be a beautiful
big time.
thing as well to celebrate folks who've been on, be like, this is what we accomplished, and then for new people, it might be a really great intro. Because it is kind of hard when you start to figure out what's the purpose of this, what's my role, do I serve it, like, so that could be really lovely if we could, it's not gonna be perfect. What's the saying, don't let good be the enemy of perfect, don't let, whatever, opposite. But if we had a goal of trying to do that, like at the end of the year, or the beginning of the year, and then folks could come who have stepped away, and then the new folks could be invited into it, I just think timing wise, that would seem like a great.
Well, I'm gonna take this opportunity to ask you all to start thinking about who else we could bring into the commission for this conversation. Ideally, be someone who's excited about new things and building that stuff, but always, we have an open seat right now, so we're always looking for people to come involved.
Erica Brown once expressed marginal interest.
I had tried Erica Brown for many years.
I know, was she told
Try
me-
to. I have pushed her. She's like, girl, I'm on too many boards. That's what she said.
Something.
Work on her, Sarah, work on her.
I saw her at the radio Kingston, we were at the Midtown Thriving training together, and she was like, oh, I'm coming off of the library board, maybe I'll do the commission. I was like, oh my god, please come on the commission. I'm gonna do it either.
I've got her for dinner next weekend, so I'll harass her. I'll give her a harass. I will be like, I will buy you a drink if you say yes. I'll coerce her.
So maybe give her some drugs.
She says yes.
Part-time.
Also, there's people who, like Troy Ellen, for sure, we can get her back for a special meeting. Kristen Mason, I'd love to get back for a special meeting. Even Louise Rowe, who's our primary funder, I think she.
Yeah, Megan and Kristen were part of the original.
Exactly.
I think they would probably, it would mean a lot to them. And it would mean a lot to this process.
Yes.
To have that dialogue with a bunch of different people who've been in it and.
Well, especially if you're trying to capture like legacy knowledge.
Absolutely.
Like, we have that.
Yeah, that's good.
Could we like emeritus them and have them still available for the meeting? They don't have a vote, but if they could still attend the meeting, because this is open, right? This is an open meeting.
And anyone can join, yes.
Okay.
Always community members or anyone as well, it's a public meeting.
Sorry, just like an admin question with the, you serve a year, do you then, if you want to do another year, is there a process or you, like, what is the?
Yeah, I believe that you can serve 2 terms for a total of 4 years, you have to take a year off and then you're welcome back.
2 terms for 4 years?
Yeah, 2 terms,
For 2 years.
2-year terms for a total of.
Oh, the term is for 2 years.
I believe so. I don't have my binder with me today.
Wasn't 3?
Oh, so you've already been on for 2 terms of 2 years. Okay.
I believe so.
Yeah.
Yeah, and at times
Yeah.
really flown by.
Yeah.
I think it's 2 years.
2 years.
I usually have my binder with me, I
Yeah.
didn't today because I came straight from a conference. I can confirm that. But it's definitely a year off
Between them.
between.
Are there other live wells other than the one in Greenville? Or is that, because I think it would be helpful to maybe look at this.
Look at some of these other,
Especially if
yeah.
they just restructured, that might be
Curious.
interesting.
Yep.
That's,
Um,
and I think now,
Maybe they're called some things like.
Right.
That would be, yeah.
yeah, but there are a lot of efforts, I mean, similar to this, that kind of emerged from that RW, the Robert Wood Johnson Foundation, Culture of Health, it was a big grant, project or program, and so there were a lot of these types of efforts that were created.
Wellness communities.
Well, yeah, kind
Florida,
of initiatives focused on social
Okay.
change.
I wonder what that looks like.
I have some of the documents from like a year or two ago from Livewell Greenville, because when I was trying to help facilitate identity identification for Livewell, we talked to Livewell Greenville because I saw they had this equity group, and I was like, oh, maybe that'll help us. So I talked to their executive director a bit, she'd shared something, so I can share that with folks, take a look at it, which, yeah, I don't remember exactly what year it's from, but that, you know, she's got a few of their planning documents, so it might be helpful for them.
all right, thank you all for that. I'm really excited to dig into this deeper. I think it's really gonna help.
When do you want to plan to have it?
I'm just gonna send out a
A
doodle.
doodle, right, so sometime in the next month.
Yeah, I mean, everyone we've mentioned, really busy people, it's gonna be impossible to get them all in the same room at the same time, but it's possible that I can maybe meet with Megan, for example, download and then report to you all, you know, so there's ways to do it, but I'm gonna first try and see if we can find a time that most of us can
We
meet.
need a space here.
Oh,
Especially in the Broadway meeting space.
yeah, that's great. So then we have just about 15 minutes. Next, we just wanna, we got some feedback from the Food Policy Council. Kristen, do you wanna, talk about that, and then we'll sort of wrap up our week?
Yeah, I can share with that, so I also sent this out to everybody. The Food Policy Council assessment, so that was, I shared, oh my gosh, like maybe like the beginning of the summer. We had applied for the Better Food Policy Fund, that was just kind of like a raffle, like a lottery to see if we could get that money for Food Policy Council. And we were not one of the recipients, but they offered the survey that they were doing, because I think they were trying to learn more about food policy councils. Like one person who's on the board or like a group that's a part of the Better Food Policy Fund works for Johns Hopkins Center for a Livable Future, working with Food Policy Council, so, you know, and they were like trying to gather information and provide us with some results. So talking about surveying, you know, we did this assessment, we identified our Food Policy Council, and we said in quotes because we don't actually have one, as the commission and as Eat Well. With the commission being the like official body that makes recommendations, you know, to elected officials, that is appointed by the mayor. And then Eat Well, you know, it's open to the public, but it's focused on increasing access to nutritious foods. And so you can see all the results in there. I'll mention them, but I'm going to use these results along with, we did an end of year survey for Eat Well, the end of 2023. To ask about folks' experiences, you know, I attached the results, and Eat Well and some of their thoughts and ideas. Only 4 people took it at the time, so I wouldn't say it's the greatest representation of Eat Well, but I also talked to a lot of people, and reading what people wrote is often what people tell me, so at least in terms of what I know, how people feel about Eat Well. And then we also were, as part of the Better Food Policy Fund, they asked us for, they called it dimensions of diversity, and we don't ask those questions as part of Live Well. So at the beginning of 2024, I sent out a survey asking people to self-identify in any sort of way, because I didn't feel like it was appropriate for me to make up these numbers on what I thought our dimensions of diversity were. So we have 3 different surveys from this past year for various reasons, so that the new chair, Nina, and I are going to use that to talk about creating a lightly structured, heavily facilitated, perhaps like brainstorming activity for eWell in our October meeting, with the goal that we would have our action plan either approved by January so that we can start off like hit the year running, because oftentimes our action plans don't get fully approved until like April, or we would have it ready in January and then in January we would vote to approve it and then be able to continue on. I don't know, I feel like the survey, I don't know if I have to take a look at the assessment, was kind of what I expected from folks, and it kind of actually reflects what people did in the survey earlier in 2024. I think 20 people took the Food Policy Council assessment, and so there's demographics in there that you can just scroll through and take a look at. What I think is most interesting that I would point you to is the very end, where people list what they think. This is like a free response, what people thought was really successful about our Food Policy Council and what people thought were challenges. And people liked learning things, they liked the presentations, they liked talking to each other. Challenges were they felt like we could use increased staffing and capacity. Everyone wrote this in a very supportive, generous way of like, increased capacity. The other one, some people commented on diversity and representation of folks, either just like diversity in general or representation of people that we are like, communities that might be already underrepresented or that we're trying to do projects to support. So like perhaps like, lower income communities or anything like that, increasing representation from there. And those are like two of the big ones in terms of challenges that I was able to pull out in that. And Nat and I will talk about how we can consider what addressing that might be like for eWell as our de facto Food Policy Council of sorts. And I also thought it was like super interesting on, like I said, everyone you can like see on there, generally it's like, we agree that this Food Policy Council is being run well. There's one under reputation. And I think this goes back to communications, which is super interesting to me because I think it's a communications thing, not like a disreputation thing. And that was where we had some of the lower scores for agree, where it says your council has established a positive reputation in your community. 20% of the responses were neutral. So I don't see that as us having a negative reputation, but us as just not having a reputation.
It's just,
yeah, and
I
then
don't
the
feel
second,
like there's a presence there.
yeah, that people maybe don't know about it. And the next one is your council is known broadly by diverse stakeholder groups. And let's see, there was like around 30% or so of people who either were neutral or disagreed with that. And then your council is viewed by the public as a trustworthy source of information. 33%, and then 1% was disagreed. Once again, it's only from 20 people, so it's like our sample count is low, but 33% said neutral. So once again, I don't think that means that people are like, oh, they're not a trustworthy source
Just
of information.
no opinion.
Just like, well, people maybe just don't look to you at all for these things,
Right.
or they don't think, they don't know
Right.
they get it from you, or like whatever. So I thought that was kind of interesting, because I feel like that goes back a little bit to this communications piece. And is that our role? Should we be focusing more on that? Like, I don't like to survey people just to survey people, and even though we had pretty small, like low response levels, I would say like overall, still plan on using this with eWell and sharing it with them to see like, I'm going to set priorities based upon this so that people can see that whenever we are surveying them, that we are then using that to make decisions to move forward. Obviously it's gonna be like, also eWell do it's like, unilaterally telling them, this is what we're doing, but I think the idea is like, if we need staffing, if we need more capacity, can people step up in a way, or can we get a working group to help identify grants, to help me with that? If people feel like we need to increase diversity of representation, like instead of having a subcommittee or working group to do something else, like should we have a working group that kind of like brainstorms that and helps to bring it to eWell forward, so. Anyways, that's it. I just thought it was kind of interesting. I wanted to share because I think it's a good to dig it. So, yeah. Any questions about it? Come to my eWell meeting. Work with me.
All right, the last thing I had on here was sort of an ongoing agenda item was the 2024 action plan for the commission. I'm gonna propose that we jump into that at another meeting. That's a whole nother discussion. Then this is at the announcements and communications part of the agenda, and then we'll call the meeting to an end. I just want to mention that I'm doing my biannual, the twice a year pedestrian and bicycle count next week. This will be, I think, the last time that we collect data for a 6-year data collection that I've done. And I've sort of made a report on the data collection that we've done, and then I'm going to possibly select new locations and maybe a slightly different way of collecting the data. So I'm sort of excited to do this last count, I have more, don't worry, and sort of close the book on this, maybe write a little report of what we found. These locations have all been along Broadway, which has now been completely redesigned. So this shows a difference in use from this huge transportation project. So I'm very excited about that. We'll sort of close that project. So that's next week. Then I came back directly to this meeting from the Walk, Bike, and Roll conference in Binghamton and have pages of notes to reinvigorate me in my active transportation work. I met with other transportation nerds who also collect bike and pedestrian and learned from them. And there was someone who does similar work as Justin for the YMCA program, because Justin was there as well. And so he got to talk to Jacob, who does work in Binghamton. So it was a lovely conference. So lots of good stuff there that will come out in different ways over.
So is there an increase in usage of Broadway?
There is.
Oh, yeah.
Biking, so the comparison is 3 of the locations were in the project boundary. One was Broadway and Andrew next to the school. It saw a decrease since 2022. So I'm really excited to finally see it change.
The Empire State Trail Bridge is very popular.
Oh, yeah.
Wow, I've changed in the last year, just driving up, it's incredible.
By the way, we're at 20 Broadway.
The Kingston Rhinecliff Bridge.
Oh, yeah.
Always
So
people.
scary.
Yeah.
Always people driving, people would like all summer long, would clearly doing like long trips.
Yes.
They have their, whatever you call them, yeah.
Our office is temporarily moved to 20 Broadway because they're doing a lead and asbestos remediation at the community center. That is, I'm looking at my window every day, seeing those cyclists in their bike bags getting lost.
Oh, okay.
And I know where you're trying to go. So yes, it feels, I think either I wasn't seeing them because we were on Broadway, or this is the time of year that people are doing that trail. I mean, daily, I'm seeing people with that new gear. Yeah, it's exciting.
Are they trying to get to the bridge or they're trying to go?
They're following the Empire State Trail.
Okay, but
The green line, if you're coming south, you are coming along the Strand, and then there's a sidewalk that takes you up to the bridge trail, or you have to go up Broadway, and there's no signage. So, that's where I see them at the bottom of Broadway on their phone looking around.
Yeah.
What's the status? I knew there was a plan that was done
Yes.
for the Green Line, like way signage, but then there was no funding to
Exactly.
implement the plan. Is that, do you have any update?
No, we're the same spot. So we are 99% done with that. The consultant just gave me a final draft and have that. What's nice about that is it'll be, I think, a good grant application. If we say, look, we already have all this, like a Greenway fund or a different, I think that's exactly what people might look for. But no, at this current moment, there's no plan to move forward with it. But I really, really wanted that project. Those are,
Sorry, update, sorry, just another adjacent thing, maybe a communications thing, the food systems plan that you were, I was part of one of the workshops, is there like an update on that?
Yeah, so we have a draft plan that is being reviewed by the Public Advisory Committee, and so they have provided extensive comments and suggestions on it, and so it's with the consultant team to incorporate all of those at the moment. We'll probably get another version of it by the end of the month. I don't feel confident in saying that that's gonna be at the time that I feel comfortable publicly sharing it with everybody. Like, there will be a town hall and there will be a public comment period for it, but that's kind of, so we're like rolling towards the end, but not there yet. Which will be interesting, because then also that's gonna be a lot of work, and a lot of times these are like administered by the policy councils, and that's why the food policy council is here, so it just goes back to all these conversations on like, what is the word and who's doing the work and all of that. So.
Any other announcements from you? Questions, Sherry?
On October 19th at the Y, we're gonna have a breast cancer awareness morning, I guess. We have someone who will be doing some education on services, and then we're collaborating with Virgo Radiology. They're gonna open their doors and have somebody explain the process, you know, being tested and, you know, preventative care. The Y will be there, opening our doors to anyone who wants to come and take classes. Just because exercise is one of those things that can help ward off certain types of cancer, so.
I love that neighbor, I love it.
Yeah. So,
Sure, parking lot.
I'm gonna be on a webinar next Thursday, if y'all would like to listen to it, it's from the American Health Foundation. I'm very nervous about it because a lot of people have registered, but it's fine, whatever, it'll be great. They're doing it actually on the good food purchasing program in New York. And so I will be there to share about what municipalities who don't do high value food procurement, so they don't fall under this general municipal law 103, like how they can support the GFPP values in other ways. So like our vending machine and like, I don't know, doing all these other things. I was telling Brendan, our intern, I was like, it's hilarious that like they asked me to be a part of this because like, oh, you don't do GFPP, so you do all these other random things, and like, why don't you talk about it? So yeah, so
Send it out.
so yeah, so I hope that
I'm on there I just saw I got the email, because I'm on their list.
Yeah.
So I thought it was pretty good, so.
yeah, I know they had my friend Laura from the city was on the last one. And it should be good. So I've been taking notes because I feel like every time I get to talk about Kingston, it's very exciting to be able to amplify the work that's being done. And I always talk about like how we have such a wonderful foundation to keep building on. That like a lot of this work has been around for over a decade. So you know, so it's been nice. So I've been trying to take notes on like all the things that are already happening in Kingston to showcase like for other municipalities that they don't do this food procurement, but they have like really strong partners, you know, that they can do this type of work. So I'm going to enjoy next Thursday.
Pay my respects, but speaking of food, the only comment I have or notice, I don't know if I've talked about this before, that the Institute got a 1-year grant from the New York State Department of Health to call it a large wellness grant. But anyway, it's a 1-year grant that we applied for to address food insecurity in Ulster County, and it's a partnership with Philly's Bridge. And a lot of money has to go to your, non-for-profit partner, a big chunk of money. I think they're very delighted. And they are going to be increasing produce production for a year. It also includes funding for a high tunnel, a very good quality high tunnel.
Oh,
to produce-
nice.
Yeah, for the winter, and the shares are gonna be, we already have a relationship with them, but they're increasing the shares to New Paltz, our Pine Street site, our Kingston site. They're also gonna be doing all kinds of like food justice related activities with community members and patients. But, so it's supposed to start September 1, but we don't have a contract yet. But things are kind of starting, so.
That's great.
I know, and we have care navigators assigned to be on site during the food, the produce distribution points too, to provide some other kinds of resources too, so, to people.
What days? It's not gonna be the same days as the farmers market, right, that we do with y'all.
Farmers market day.
We do.
Oh,
farmers market with
Well, it's not farmers market, it's a produce,
the
yeah,
district-
at Kingston,
Yeah.
yeah, no, it won't be.
Okay.
Yeah,
I
we'll
was like,
figure it
I was
out.
like, oh, they
Don't
want to do
worry.
it. They're just let me know.
Yeah. We'll work that out. We have people like assigned staff to,
I mean, we love when another farm kind of.
can come in and help, yeah.
Yeah. Take our place. It's-
Oh, no, I don't think it's gonna be, the need is tremendous. There's a huge need, yeah, and Pine Street doesn't have anything, so I think we're gonna have to figure out how to, how
Happy
much
to work-
is there.
Happy to work with Pine Street too, if you ever want.
Oh, really?
Yeah.
Oh, yeah, well, actually, you know what, the place that has really become a food desert is Ellenville.
Yes,
Yeah.
Yeah, it's really a food desert.
yeah.
We're so Kingston focused right now, so.
Yeah, so, I know Phillies Bridge, I was able to send a bunch of suggestions that they had, because we asked if they could do it there, actually instead of Kingston.
Oh.
And they just couldn't transportation wise, and, but they gave me a lot of information to pass on to Samantha Riley, who's at Rural Health Network there. Because they have something called, they call it pharmacy, but it's really leftover food items, not necessarily produce from other agencies. But they say 2 hours before they start once a week, the cars line up. 200 cars.
Yeah, we talked about like, it'd be a CHISC site, so we could support with some equipment purchases, but they want, I was like, well, we can't do it just as a produce distribution. I like, because CHISC only lets us work with new, like, sites that are increasing their healthy offerings. I can't work with a place that already offers healthy things, so I said if you could set it up as like more of a farmer's market style and have all the different food groups, we could do that, but she said like there's no way that they only do the drive-through right now, and they had such a crazy long
They go
line.
crazy on me, yeah.
I was counting, Kingston now has like over, I think 16 or 17 sites to get free food.
Really?
In our small city.
Wow.
And then you'll get some.
Well, I
I
just
know.
coming over,
Wow.
I'm
I
across
know.
from the church and they have well over 300 people.
Yeah.
Oh, yeah, they had to,
Wednesdays?
Yeah,
well, they had to cut it used to be weekly, and they had to cut it to every other week for people to come twice a month instead of 4 times.
A lot of it was volunteer, just capacity.
yeah.
I mean, my
Yeah.
like it's all volunteer. Well, you're on the board. I work with Leslie and
Well, no, I'm
Kim.
not on the board,
You're not
I'm on the
oh,
health committee.
That's right.
Yeah.
I work with Leslie and Kim because they're
Yeah.
also a CHIP site,
Yeah.
so like, work
Yeah.
them, but yeah, that seems tough.
Anyway, but, and I will talk to you at some point because we're hoping to move the needle on actually having, what do you call it? We have food at health centers. Like
Like
that.
an RX program?
Yeah, when you have like, yeah, but no, well, it's funny that term is funny.
Oh, we were talking about Healwell doing some sort of like
Like a
pantry toolkit.
A
but,
toolkit,
like,
yeah.
Yeah.
And having some kind of like a food pantry of like
Yeah.
boxed goods and stuff,
Mhm.
because there's some interest in that.
Yeah,
So
let's
we have to
talk
get
about
funding
it.
for it, we have to get funding for it first, but
Yeah.
that's what we're talking
So-
about, yeah.
Always.
Or you
Sorry.
can get free produce for us.
What's that?
So we can, okay.
It's like, for you, for you.
Okay, right now, anyone providing food in Kingston, we're trying to even it out, that's why we're focused on Kingston, is that we will provide artists.
Okay, good, great, okay.
Okay, next meeting is October
Yes.
16th.
And I won't be
Get a
here,
report from
on
Groveland,
vacation,
right?
sorry.
You're not gonna be here.
Oh,
Yeah.
okay, thanks so much.
Yes.
October 16th, October 16th.
Okay.
Thanks, Kristen.
Thank you,
Thanks,
everybody.
Natalie.